Welcome back.
We started out talking about feet, and I was going to have a nice segue because I know from my own chiropractic experience, if you have problems with your feet, it goes all the way up.
Yes, it
and
does.
Oftentimes, if you've got a bad neck, it's because something's out of line way down here.
Oh, really?
Yes, that's what Dr. McCoy told me.
No.
Yep.
He said it just kind of all goes up, and people have a lot of tension in their neck. They, I have a bad neck. No, you got a bad back, got a hip out of line, got a bad knee.
Got to start at the foundation.
Yep. And it moves
Works from
right
the
up.
ground up.
So it's really important to have good shoes and take care of yourself.
We have with us in the studio here, Dr. Kayla Hatch is on my left here, and next to her is Dr. Clint Freeman. And they are actually, both of them are chiropractors,
Yes, sir.
but they're
Are you
not,
both local here in town?
Yes,
ma'am.
Okay.
but they're not in the same office.
Oh, I know, yeah.
They're not even
I
competitors.
heard them talking about, well, we'll send them to you and send them to you, and they were back and forth.
So this is, you told me earlier that this is kind of a coalition.
We're trying to get a coalition going in Mountain
Yeah.
Home. They have lots of them all over the place. We even have national ones, but we're just trying to educate people on chiropractic.
And how did y'all get to know each other?
Just through the just through.
Yeah, and I
moving
actually
into
met him
town.
when he was a chiropractor in Marshall before he even moved up here. So
I kind of researched the town. Even Dr. McCoy, he's the one that even talked me into coming over to this town. And so then, I made sure and met Dr. Hatch, and then I've met almost every chiropractor in town. Where I'm getting close, and so Dr. Hatch and I, we've pretty much stayed in contact since, and we just came up with the idea that there's no such thing as competition in business. If you help each other, all businesses grow.
Yeah.
And so I said, we were talking over lunch one day, and I said, man, we really need to try to educate the public on what chiropractic really is, because most people don't really know what chiropractic does.
Yeah.
They have ideas, but they don't really understand the full extent of it.
Yeah. For I think at the beginning of medicine, it was a doctor's field, a general practitioner, and the chiropractors were kind of over here, And we talked about stigma, and that stigma was quite large. You didn't want to be a chiropractor in the day, but chiropractors have been in business for many years. And so your focus is trying to get education out to the public on the benefits of what you specifically do. Now, do you do the same type of chiropractic? Is it all the same, or different methods, or?
Almost every doc out there has a different philosophy and different method. There's hundreds of techniques to adjust, and that's the human spine. But everybody says, well, what's your technique? And before it's over with, usually when you've been out of school for so long, it's the Dr. Hatch technique, it's the Dr. Freeman technique. But
so whatever works for you.
We all learn certain techniques in school, and then we kind of pull a lot of the information out from that. And everybody has a same philosophy, but everyone practices different.
Yeah.
And so, and I always explain to people don't try chiropractic, they try a chiropractor. And so if you go to a chiropractor and you didn't like the experience, you never try another one.
Yeah.
But if you go to a medical doctor and you don't like them, what do? You just go to another medical doctor.
Right,
so I always encourage people, if you come to me and we don't really jive, you don't like my philosophy, go try Dr. Hatch. If you don't like her, go try Dr. Rose or Dr. McCoy. there are all kinds of great docs in this town.
But they go, ooh, I don't like chiropractors.
Yeah.
They hurt. I went to one, he hurt me, or something like that. And I know that, like I said, I use Dr. McCoy, and he's been wonderful. I could even turn my neck. But chiropractic, people should think of it more as prevention. And we tend to wait till we're bent over like this and twisted and go, well, I need to go to the chiropractor. Where if you have an issue, if you get regular chiropractic visits, and you don't have to come every week. I go like every 6 months and get a little bit of tweaking here and are told to do a few things on your own. It can make a world of difference. That's what they think, well, I'll wait till I'm miserable, and then I'll call Dr. Hatch. When if they would call and routinely see you like they would a yearly checkup with a physician, it would benefit them greatly.
And that's why we're trying to get the education out there, because you don't wait till your tooth hurts to go to the dentist. Everybody just goes to the dentist, whatever their regimen is, once a year, every 6 months. So you don't wait until you need a root canal to go to the dentist. You just automatically go, and ahead of time that you may have a problem coming up in the next year or something, and you can kind of head it off. And that's why we're trying to educate people on what chiropractic is, what it does, what conditions it can help.
Well, explain some of the patients without naming names. We don't have to do that, but maybe some of the conditions that you help your patient with, or maybe something that happens to a person every day that they probably should seek you guys out.
What I always tell people, they ask, what does chiropractic treat? And I say, chiropractic treats the vertebra of your spine of vertebral subluxations. Now what that means is the spine gets misaligned. When you get misalignment, then you can actually cause your nervous system to no longer work at the highest function that it should. And so if you ask me, do I treat heartburn? I'm going to say no, we don't treat heartburn. We treat the nervous system. But if the nervous system is being decreased to where, and I always use the heartburn or the example, if you suffer from chronic heartburn and you come to my clinic or her clinic or a chiropractic clinic, you may never think that heartburn has anything to do with your spine, but it could think about this. Your brain controls your stomach, correct? Well, if your stomach has to be controlled by your brain in order to digest your food properly, what if there's something blocking the signal from your brain to your stomach and it doesn't digest your food properly? It could result in indigestion, heartburn. You may be producing too much acid, maybe too little of acid, but it could be causing the problem. So does someone say, do I treat heartburn? No, I treat your spine, but a direct correlation could be that your heartburn goes away because now the innervation or the nerve signals from your brain to your stomach are flowing better. There you have an increase in nerve signal. Therefore, what we treat is your spine, but what we can help is kind of limitless. If your nervous system is functioning at its highest possible level, you're going to be a healthier individual. And so we see a lot of fibromyalgia patients, heartburn, migraines. Of course, most people think we're pain docs, and we are. We're very efficient at taking care of pain. But we do more than just pain. I mean,
and we help people from babies to the very elderly. You know, I can't tell you how many babies I've helped avoid having to put tubes in their ears from ear infections. A lot of times it's because they get twisted and turned in the birthing process, and if you straighten that out, their ears are fine.
Oh, really?
Wow.
So if somebody wanted to see you, can they just come in and can you evaluate anything that needs to be done or help?
We do a complete evaluation on them and then decide if we could actually help them. I mean, some people you're not going to help, and so you decide, you know, if you can accept them as a patient, if you think that you can help them.
And if we can't help them, we try to keep good relationships with all doctors in town. I'm fairly new to the town, and so I'm trying to develop these relationships. Dr. Hatch has been here for many, many years. She knows almost all the medical doctors, all the specialists in town, and I'm trying to develop that because there are patients come in, and if it's something that I don't think chiropractic will help, I will refer them out. And it's most of us in town most chiropractors in town aren't the we can cure anything type of chiropractors. We can help usually in something, but it doesn't necessarily mean that every patient that walks through our door is going to be able to be helped. So that's what the evaluation's for. That's what the exam is for. I mean, you have to tell us what's happened to you. That's the exam, the consult, just trying to figure out your history.
One of my signals is always a dull headache. Not one badly enough to take medicine for, but I'll just start and think, well, it's time to go see Dr. Joe because something's not quite jiving like you said, and when I get tired, I have just a very soft, dull headache that I only notice when I'm still, and it's like, and I can get popped and cracked and straightened out, and it just takes it away. And maneuverability, I think sometimes as we get older, you think, well, I'm not supposed to be able to move my arm like this anymore. Oh, I can't look over my shoulder anymore. Well, you could if you would go and get, some sort of help. People just, I'm getting old and stiff. Well, I don't want to get old and stiff.
People accept. They accept that old age means decreased lifestyle, and that is absolutely the farthest thing from the truth. The healthier your lifestyle, whether it's diet, nutrition, exercise, regular chiropractic care, you will continue your quality, not only quantity, but a quality of life. And which is more important, quality or quantity? Because I know a lot of people that are in a rest home or in a hospital somewhere right now with no quality of life because they made really poor lifestyle choices. And I mean, it's not about trying to get old and not being able to move anymore. you can have a great life if you choose to. That's why we say chiropractic is for all ages.
I adjusted a lady right before I came over here that's in her 90s and had just left Zumba class.
She just left Zumba class.
She just lives life to the fullest.
And that's why she
amazing.
can go to Zumbas, because
Yeah.
she gets pumped and cranked around, taken care of.
Thank goodness her granddaughter's a chiropractor up north, so she's known about it a long time.
Okay.
And so
Let's take a real short break, and we're going to do two segments on this, and we want to dig a little deeper on some of the benefits of chiropractic. And we were talking with Dr. Clint Freeman and Dr. Kayla Hatch. So we'll be back in just a couple minutes. Stay with us.